Yes, so it's 3 o'clock and we're starting now. Thank you so much for creating time to be with us this afternoon. It promises to be a very interesting afternoon. And wherever you are in any part of the world, I say good afternoon, good morning, or good evening. You're welcome to this special webinar. And I would like to recognize the encouragement and participation of the Association of the General and Private Medical Practitioners of Nigeria, who have been so supportive in this. And this also, we are taking this into consideration. And that's where we're merging the practice and the business of medicine together this afternoon. So we're talking today about HIFU, and then we're also talking about financial literacy for doctors. So this promises to be a very good and entertaining and enlightening webinar this afternoon. Just come along with me. I will be discussing the justification for HIFU, and then Dr. Amarachukwu Njoku, who is a seasoned gynecologist and is the head of the Fibroid Care Centre at Nordica, will be talking about the journey with HIFU so far in Nigeria. And then if you permit me, the last speaker, who will be the biggest masquerade, I guess, Mrs. Funmi Babington-Ashaye will be handling the topic financial literacy for doctors. I think this is going to be very interesting. Anytime I listen to her, I still pick one or two things about your finance. And I guess that's one of the things that we doctors don't know, that we're managers, especially those of us who are managing practices. And it's very important for us to be able to look at what the business is doing and be able to actually also have budget and predict what you are going to do in the future. But I'm sure she will handle all that for you. So I'll just introduce the speakers. Well, I think I've introduced Dr. Njoku, is the head of the HIFU unit in Nordica. Mrs. Funmi Babington-Ashaye is the MD CEO of Risk Analyst Insurance Brokers Limited. And she was former Managing Director, Chief Executive Officer of Cornerstone Insurance PLC and Nikon Insurance PLC. She has over 33 years experience in the insurance industry, and she was the 48th president of the Chartered Insurance Institute of Nigeria. She's also an author and a mother. So thank you so much, Mrs. Ashaye, for being here today. And I think we just get this started. So I'm going to talk about why the rationale for HIFU in Nigeria, because sometimes some people ask me, why HIFU in Nigeria? So if you listen to me in the next couple of minutes, I'll tell you how and why we think HIFU is something that we should look at in Nigeria. So I'll be kickstarting this story of HIFU in Nigeria, and Dr. Njoku will take it over and tell us how the journey has been so far. So if you just join us now and take a good, comfortable chair, and then please come along with us. Yeah, technology it is. Yeah, I'm trying to get to share my slides. I guess in a few minutes that should be done. Okay, so I'd like to start by introducing you to the Fibroid Care Centre in Lagos. This is where the HIFU machine is located. This is the only HIFU machine for now in the whole of West Africa, and the third in Africa. So we hopefully, by the time after this presentation and over time, we get many other doctors to be interested in this wonderful technology. So what is HIFU? This is High Intensity Focused Ultrasound. It's a non-invasive technique that uses non-ionizing ultrasound to hit or ablate tissue. So there is no ionizing radiation when you're using the HIFU. Well, it can also be used for solid tumors, including some cancers. But in Nigeria, basically, we're using it for now for both fibroids and adenomyosis. And Dr. Njoku will tell us during his presentation how common we have seen adenomyosis to be in Nigeria. Now, but I'm going to limit most of my talk to uterine fibroids. And then we all know so much about uterine fibroids because it's probably one of the commonest growth in the pelvis of women in their reproductive age group in Nigeria. And we say that up to 80% of our women have a lifetime risk of having uterine fibroids. We still don't know what causes uterine fibroids. The symptoms is such that many people don't have any symptoms at all, and that's why it's difficult sometimes to pick up. And then when they have symptoms, the commonest probably is that they just have a mass in the abdomen, or there is a swelling in the abdomen, or sometimes it gets bad that you have pressure symptoms from the surrounding organs, like you could have constipation, there could be inadequate emptying of your bladder. Sometimes it gets really bad that actually there's back pressure of urine, that you can have what we call hydronephrosis from back pressure of, with the ureters. But sometimes also what they have is abnormal bleeding. Either the menstrual period is really very heavy or the bleeding between periods. And then sometimes they have pain. Most of the time it's menstrual pain. The menstrual period really becomes very painful. And sometimes they also have problems with their reproduction. So infertility is one of the things that uterine fibroids could present with. There could be miscarriages, and then they could have complications during delivery, which could be malpresentation, or they could have abruptio placenta during pregnancy. Generally, quality of life is an issue, and when you have symptoms, quality of life is at stake. Well, the figure has looked at how to help us with classification of uterine fibroids, and this is Dr. Njoku will be talking more about this. This is the figure classification of uterine fibroids, and don't want to spend so much time with this. But most of the time, one of the questions that we ask is, when do we treat fibroids? And so one of the articles I love that addresses this topic is this article by Elizabeth Pritz. Pritz works at the Wisconsin Fertility Centre in the United States of America. And she wrote this beautiful article talking about when to treat fibroids. And some of the things that were noted was that in this paper was that you do not need to treat fibroids prophylactically because there is no reason for anybody just to see fibroids. It's not every fibroid that you need to treat. And therefore, the fact that some people will say, oh, I think this fibroid is going to give problem either in pregnancy or is not tenable. Unless the fibroid merits treatment, you don't treat fibroids prophylactically. And she went on to look at the fact also that you need to look at the symptoms could be from the size of the fibroids, from the location of the fibroids, then whether it's distorting the cavity. So we have some mucous fibroids which are distorting the cavity, or the intramural fibroids. And then also in our review, she saw that the non-invasive methods, like what we're discussing today, HIFU, and the other non-invasive embolization, are becoming much commoner in practice than what used to be the norm. And so let's look at one of the things is that we're always talking about the relationship between fibroids and infertility. And that is one of the things that also we're going to consider today. How does fibroids also affect fertility? I'm sorry, I'm having some problem with my slides. Okay, I think we're good. This work by Dones shows how fibroids could affect fertility, from uterine cavity distortion to the blood supply could be of the endometrium and the myometrium can be impaired, to increase uterine contractility, to the fact that fibroids can secrete some hormones, which could give some inflammatory reaction, which will affect implantation. So those are some of the ways that fibroids could affect fertility. And then this, you cannot talk about fibroids without looking at this. Probably is one of the biggest records about fibroids and infertility. And this was a systemic review by Pritz again. And she discovered that fertility outcomes are decreased in women with submucous fibroids, and that removal seems to confer benefits. So when you have submucous fibroids, it's better to remove them. But intramural fibroids are not like that. They tend to decrease fertility, but the results of myomectomy are just unclear. Subserosal fibroids, on the other hand, do not affect fertility at all. And this also, it's a more recent meta-analysis done by this Canadian group, which was released last year. And there's always been this debate about non-cavity distorting intramural fibroids. We've talked about the submucous fibroids, that they need to be removed. But we've talked about the intramural fibroids that distort the endometrium, that they also need to be removed. What about this non-distorting intramural fibroids? And they discovered that this reduces, there is no doubt they reduce especially IVF outcome. It says they lower the IVF odds by about 44%, the chances of you getting the live birth from IVF, and 32% the chance of having a clinical pregnancy when you compare women with fibroids, intramural fibroids that is non-cavity distorting, with women who don't have fibroids at all. Two factors they also recognize might be very important here: the size of the fibroids and how close the fibroids are to the cavity. And what they consider to be the cutoff point was 3 cm. That's talking about the size of the fibroids. Now, let's talk about treatment options. What are the options available for treating fibroids? We have the surgical options, hysterectomy, myomectomy. This could be laparoscopic, this could be laparotomy. This could also be vaginal myomectomy, hysteroscopy, cryotherapy, thermocoagulation, what have you. And then we have the non-surgical alternatives, like we're talking about the HIFU, we're talking about embolization, and then of course there's the medical therapy. The agonist and the progesterone receptor modulators. In Nigeria, open myomectomy is still the major treatment. Laparoscopy is gaining more popularity, but still not very common. We at the Fibroid Care Centre are one of the people who are doing laparoscopic myomectomy. And in 2015, we published this about our experience with the first 31 cases that we did laparoscopic myomectomy. Of course, now we do quite a lot more. Out of the 31 women, we removed about 139 nodules, and the largest number of nodules from one patient was 14. 3 out of these 31 patients had blood transfusion, and the mean hospital stay for the patients was 2.77 days. Now, just last week, we did this patient that we removed 27 nodules from her. So we garnered so much experience now. We're more daring, if you want me to say, and because this team is now very, very experienced from 2015 when the largest that we could get from one patient was 14. And now, but I must also warn that myomectomy is not a procedure without risk and can result in very serious complications. So there is no other way but that you need to have a lot of experience before you can do this. And we can see the audit from the clinical audit from University College Hospital in Ibadan, where there was a report that they had, they reported for 2 years, and they saw that they had a 25% intraoperative complication rate, and they had a 29.3% postoperative complication rate. The higher odds of developing intraoperative complications were among those who had general anesthesia, those who had more than 10 fibroid nodules removed, those who had pre-op PCV less than 30%, and those who have had previous pelvic surgery. For the postoperative complication, it was higher in those who had general anesthesia or pre-existing medical conditions. So one can see that general anesthesia happens to be something that if we can avoid, complications will reduce. One other thing that probably we will see from the next paper that we're going to look at, this paper was written by Dr. Ndabuba from Olu in southeast Nigeria, and they saw that in Imo State University Teaching Hospital, they had as high as an 86% blood transfusion rate after myomectomy. They had pyrexia of 44%, and then there was no mortality due to severe hemorrhage. You will see from this that the greatest things that we should be afraid of, or which causes a lot of problems after myomectomy, happen to be 1, general anesthesia, 2, hemorrhage. So if we can reduce that, we'll be able to reduce at least the intraoperative and the immediate post-operative complication. But there's still another complication, which is what we're looking at now, which is intrauterine adhesions. When we looked at some of the things that we have done here, we looked about 900 patients with who did the hysteroscopy in Nordica Fertility Centre. What we saw was that we had about a 51% chance of you having abnormalities in your uterus, and 50% of this was directly related to myomectomy. So we can see that on the complications from myomectomy include intraoperative, include immediate postoperative, and also long-term fertility impact from this. And this is also another paper where there was this Cochrane review, which was done from Sheffield in the United Kingdom, and 4 RCTs, which involved 442 women, and they concluded that it was assessing whether myomectomy actually increases clinical pregnancy, or whether it actually increases clinical pregnancy rate, whether it reduces miscarriage rate for patients who have intramural fibroid. So one of the questions one keeps asking, this surgery that we do so frequently, who should be having it? Who really deserves to have it? You know, so there are things that we really still need to start asking ourselves. And they saw also that the recurrence rate after 4 to 5 years was about 60%. So really and truly, we will see that myomectomy is a procedure that we really need to review. And that reminds me of, I'm sure most of us know about Abraham Maslow, who is more common for the Maslow hierarchy of needs. But one of the things that he said is that if the only tool you have is a hammer, you tend to see every problem as a nail. And that, I think that has been one of the things that we've had with fibroids and myomectomy in this part of the world. It's so common that we see a lot of fibroids, and over time, we almost believe that every fibroid should be removed. And that's why one of the commonest surgeries that we do is probably myomectomy. But why then do we think HIFU is important? Or why do you think HIFU will be useful in this environment? We think it provides one important word, option. We don't think everybody should have HIFU, but we think it's one of the options that doctors should consider when they see their patients with uterine fibroids. And the interesting thing is that it is also a safer option. All the things that we have seen, you don't need blood transfusion, you do not need general anesthesia. So it's a much safer option for people who qualify to have HIFU. So patient selection is key for us to be able to use this very beautiful equipment that Dr. Njoku is going to be talking to us about. And this is the HIFU machine in the center at the Fibroid Care Centre. Thank you so much for listening. And I think right now, I'll just hand over the floor to Dr. Njoku, who will be telling us about he's done 18 patients now and their experience with the first 10 patients. Thank you for listening.
On, then put this one on.
Yeah, go on. You are on. We can see you.
Good afternoon, sir. Thank you for the wonderful introduction on HIFU. It is quite educative. Good afternoon, all. So, in continuation with the presentation, I would discuss about HIFU, and I'll talk about our journey so far in Nigeria. Okay, my MD has said it all about HIFU. Generally, the principle of HIFU is stand for High Intensity Focused Ultrasound. Just as the name sounds, it means focusing ultrasound to generate intensity at the focal point. So from the diagram, the principle basically is focusing ultrasound energy using an extracorporeal transducer, like in the diagram. Now, this energy is focused on a target. The target is the uterine fibroid or adenomyosis. And at the point of focus, we have the greatest intensity. So this sound energy is converted into heat in the temperature range of 60 to 90 degrees Celsius at the focal point. And this heat causes instantaneous and irreversible coagulative necrosis of the target tissue. It simply means that the heat causes the fibroid tissue or the adenomyotic tissue to die. So the benefit of HIFU is non-invasive, we will say that. So there is no need for surgery. It's non-invasive. It does not require anesthesia. It preserves the uterus. So the potential for fertility in the future is preserved. There's no need for blood transfusion. HIFU is usually done as a day case. So there's quick recovery of the patient to her normal activity. It's repeatable. What we mean by that is compared to open surgeries. Sometimes open surgeries, after an open surgery, there's adhesion, sometimes frozen pelvic. So it's difficult to repeat a myomectomy, but HIFU is repeatable. It's non-invasive. So who qualifies for HIFU? First of all, the patient must, there should be diagnosis of uterine fibroid or adenomyosis for these patients. And symptomatic, presence of symptoms like increased menstrual flow, painful menstruation, pressure symptoms, frequency urination, sometimes constipation. So symptomatic uterine fibroid. The previous speaker said that fibroid treatment should be justified. There should be merit for fibroid treatment. So the fibroid should be symptomatic. Then some patients that are fit for surgery, they have the indication for surgery, but they are afraid of invasive surgery. Also, some other that are not fit because of medical comorbidities, maybe cardiac problem or other comorbidities that made them unfit for surgery. HIFU is ideal, is an option for such patients. So relative complication, what do we look out for that will make us, because one of the key things we consider in HIFU is patient selection. We select our patient carefully. So going by the FIGO classification of fibroids, for fibroids type 0, that's the pedunculated submucous fibroid, and type 7, the pedunculated subserous fibroid. For these types of fibroid, we are very careful with HIFU. The reason being that after treatment, the tissues undergo shrinkage. You know, the treatment causes coagulative necrosis of these tissues, as the death of these tissues. So after treatment, the immune system now take these tissues out. So they undergo shrinkage. So while shrinking, they might detach from the peduncle or the stalk. And maybe for the ones in the subserous part, the type 7, they might float, they might detach and float in the peritoneal cavity. The submucous fibroid is advised, advised to use a hysteroscopy for such a type of fibroid. But other types of fibroid, as shown in the FIGO classification, can be treated with HIFU. Then for HIFU treatment, we usually use a conscious sedation for these clients. So if a client, maybe for medical reasons, they are not suitable for sedation and analgesia, such patients, we are careful using HIFU treatment. So people that have done abdominal liposuction, the sound waves travel through the anterior abdominal wall to the target organ, the fibroid or the adenomyosis. So if there's history of liposuction, sometimes it heals with fibrosis, and it can cause dispersion of this sound wave. So for such group of patients, we are careful using HIFU. HIFU also requires a patient to lie prone, that's facing down on the HIFU table for some time. So we advise them to, as much as possible, not to move during treatment. So most feedback and response are verbal. So these clients need to actually communicate with the health personnel. So people with communication difficulty, people with hearing problem, for such patient, we may be very careful with such patient, because of we need that communication when we are doing the HIFU treatment. Then for people that have passed menopause, fibroids should shrink after menopause. So if fibroids are still growing after menopause, we usually suspect risk of malignancy of the fibroids. So we are very careful using HIFU for such women. Then absolute contraindication. In this condition, we usually don't advise HIFU as a treatment option. People that have done a radiotherapy for maybe pelvic malignancy or any other reason, radiotherapy causes tissue fibrosis. So, and we need what we call an safe acoustic path when we are doing HIFU. So the triangular region, there shouldn't be any organ that contains gas within that triangular region. So because of the high risk of adhesions after radiotherapy, such patients are not fit for HIFU. Then if patients that have a gynecological malignancy, like ovarian or cervical or uterine malignancy, such patients also are not very fit for HIFU. We talked about that patient lying prone during HIFU treatment. So if patient maybe have any medical condition, maybe lumbar disc disease or other disease that prevent them from lying in such position for a very long time, for about an hour, so such patient may not be fit for HIFU. Also, pathologies of the fibroid, like cellular fibroid, whereby the fibroid has increased blood supply. Also in malignant transformation of fibroid, also we we are very careful using HIFU. Such clients are not fit for HIFU. There is a HIFU offers us a low post-operative complication. A study done in Hong Kong, about 140 patients we are treated for fibroid and adenomyosis. And out of these clients, about 3 of them developed mild complications such as skin burn, back pain, and temporary sciatic pain. This further buttresses that the complication profile for HIFU is low compared to open surgery. One of the largest study done on HIFU is done in China. About 2,400 Chinese women were studied in 2 arms. One arm did a HIFU treatment, and the other arm did invasive surgery, hysterectomies and myomectomies. And the complication rate were compared. For HIFU, about 0.2% complication was seen in people that did HIFU. While for people that did surgical procedure, about 12.6%. You can see that the difference in complication rate is quite significant. So HIFU have a low complication rate compared to open surgery. Down to Africa, studies also have been done in Black women in South Africa about for HIFU, and it was found that HIFU is both safe and effective in Black women. So HIFU can be applied for Black women. It's effective in Black women. So I will discuss some of the cases we manage in Fibroid Care Centre. Our first case, a 38-year-old para-0. She presented with heavy menstrual bleeding, urinary frequency, and constipation. The MRI showed an intramural posterior myoma about 9 centimeters in diameter, as shown in the diagram. That's a T2 MRI image showing a solitary myoma looking on the endometrium. So the patient was treated with HIFU, and you can see this is a contrast ultrasound. It's a contrast ultrasound image we did before and after HIFU. The halo area in the image shows the area that was ablated, and we are able to achieve 90% ablation of the myoma. During follow-up, the next menstrual period was normal. Case 2, a 31-year-old lady, para-0, presented with history of heavy menstrual bleeding and severe dysmenorrhea, that painful menstruation and prolonged menstrual period. She had, because of the heavy menstrual bleeding, she had repeated blood transfusion due to severe anemia, and also she used a Zoladex injection, which is a gonadotropin-releasing hormone analog for the severe menstrual pain. Her MRI showed a posterior wall adenomyosis. That's a T2 weighted image MRI. You can see from the image the posterior wall of the uterus is thickened, and there is this white area showing the endometrial tissue dispersed on the posterior wall. There is no circumscribed area of myoma. That's the MRI feature of adenomyosis. The patient was treated with HIFU, and you can see we achieved ablation of the adenomyotic tissue, the posterior wall adenomyotic tissue, and after treatment, the patient received Zoladex injection. Her next menstruation normalized, the flow normalized, and the severe painful menstruation improved significantly. Case 3, a 35-year-old para-0 presented with heavy menstrual bleeding and associated severe anemia. This client have to quit her job because of the heavy menstrual bleeding and the anemia. The MRI showed a submucous myoma about 4 centimeters in diameter, and a multiple intramural myoma. So we are able to achieve 92% ablation of the myoma. You can see from the contrast ultrasound before and after the HIFU procedure. You can see the submucous myoma, the black area that was ablated, and the multiple intramural myoma that were ablated. Her next menstruation was normal after the HIFU treatment. These are an MRI images that compared before and after the HIFU procedure. Is a T1 contrast image. We used to check the blood supply of the myomas. So this was before the procedure. The image have a significant enhancement of the myomas, and after the procedure, you can see the black areas show that there is no enhancement. That means the blood supply of the myomas there are cut off. The myoma tissues are dead. So that's the image before and after treatment. Case 4, a 45-year-old para 1 lady presented with heavy menstrual bleeding of 3 years duration and severe dysmenorrhea of 4 years duration. She used Zolades for the severe menstrual pain. The MRI image showed a submucous myoma. You can see from the picture, the submucous myoma, you can see the endometrial strip. The submucous myoma is hypointense and fundal adenomyosis. So we're able to achieve 90% ablation of the myoma in the image. That's a contrast ultrasound image before and after HIFU treatment. The client received the Zolades injection following HIFU treatment. And next month sees both the menstrual bleeding and the severe menstrual pain improve significantly. The T1 contrast image before and after HIFU treatment. Before HIFU treatment, there is significant enhancement of the myomas. And after treatment, the submucous myoma showed no enhancement. It means that the tissue has been ablated. And this image showed the fundal adenomyosis. This is another section that shows the fundal adenomyosis also has been ablated. A 43-year-old para 0 present with heavy menstrual bleeding and severe dysmenorrhea. The MRI showed multiple intramural myoma, about 5 centimeters. The largest were about 5 centimeters and 4 centimeters in diameter. Then there's an anterior wall adenomyosis. That anterior wall is thicker than the posterior wall. So during the HIFU treatment, we were able to achieve 88% ablation of the myoma. That's the the contrast ultrasound scan image before and after the HIFU treatment. The client received a Zolades injection after the treatment, and her next month after HIFU treatment, the flow was normal and the severe dysmenorrhea improved significantly. The T1 contrast image before and after HIFU treatment. Before the treatment, the myoma have significant enhancements, and after treatment, the myomas have no enhancement, showing that we achieve adequate ablation of the myoma. Cases, a 41-year-old lady, she was para 0, presented with heavy menstrual bleeding and abdominal swelling, all of 5 years duration. The T2 weighted image MRI showed multiple intramural myoma. This is another section showing the multiple intramural myomas. We are able to achieve 93% ablation of the myomas. That's the ultrasound image before and after HIFU treatment. The black area are the ablated myoma. Menstrual flow normalized subsequently after the HIFU treatment. This is another image showing the ultrasound image showing before and after HIFU treatment and the area that was ablated. These are T1 weighted contrast image before and after HIFU treatment. Before HIFU treatment, the myoma has significant enhancement, and after HIFU treatment, there is no enhancement of the myoma, showing that the myoma have been ablated. This is a cross-sectional MRI image at the T1 contrast image of the myoma after treatment, showing no enhancement of the myoma. We will achieve adequate ablation of the myoma. A 46-year-old para-0 lady, she had a miscarriage at 8 weeks gestation, 6 months prior to presentation. And she had a myomectomy a year prior to presentation. The abdominal scar was a transverse suprapubic scar. The MRI showed an intramural anterior myoma with a submucous component with a diameter of about 4.5 centimeters. From the image, you can see the anterior intramural myoma pushing on the endometrial strip. We're able to achieve 86% ablation of the myoma. That's the contrast ultrasound image before and after HIFU treatment. The next case, a 45-year-old para-1, she had a previous cesarean section, presented with severe dysmenorrhea of 9 years duration, and she used the Zolades injection for the severe menstrual pain. The abdominal scar was a transverse suprapubic scar. The MRI image showed an anterior wall adenomyosis. From the MRI image, the anterior wall, the anterior uterine wall is thicker than the posterior uterine wall, and there is no circumscribed massing. The contrast ultrasound image showed the adequate ablation of the adenomyotic tissue after the HIFU treatment. She received a Zolades injection, and her severe menstrual bleeding increased significantly following the HIFU treatment. A 43-year-old para-0 lady presented with abdominal swelling and urinary frequency of a year duration. She had had open myomectomy twice in 2009 and 2017, and both myomectomies were done with a transverse suprapubic incision. The MRI image showed multiple intramural myoma. The largest myoma was 10 centimeters in diameter, and another was 7 centimeters in diameter. The contrast ultrasound image before and after showed that we achieved a 90% ablation of the myoma. You can see the image before and after with the black area showing the ablated myoma. The urinary frequency improved subsequently following the HIFU treatment. These are MRI image, the T1 contrast image before and after HIFU treatment. Before treatment, there were significant enhancement of the myoma. And after treatment, you can see there is no enhancement of the myoma, showing adequate ablation of the myoma. A 40-year-old lady, para-1, with a previous cesarean section, she presented with heavy menstrual bleeding of 4 years duration and prolonged menstrual period of 3 months duration. The abdominal scar was a transverse suprapubic scar. MRI showed a submucous myoma about 3 centimeters in diameter and multiple intramural myomas. This image of the contrast ultrasound before and after HIFU treatment. Before, we achieve about 85% ablation of the myomas. From the image, you can see the multiple intramural myoma and the submucous myoma being ablated. her menstrual bleeding reduced significantly following HIFU treatments. Some of the complications so far we have seen from our experience with HIFU treatment are lower back pain, mild transient lower back pain. Some of the clients had lower back pain during the HIFU treatment and the pain disappeared after treatment. Then lower abdominal cramps. Also, I think about 2 clients have lower abdominal cramp, and 1 client had a transient leg pain during the treatment, which disappeared subsequently. This shows that the complication rate for HIFU is quite low. In conclusion, from my experience in HIFU treatment of uterine fibroid adenomyosis is quite effective, and the diagnosis of adenomyosis is often missed. Some of the clients that we manage for adenomyosis, when they presented, we are told by previous clinicians that saw them that they have uterine fibroid. So the adenomyosis were picked during the course of our evaluation. So the adenomyosis is often missed. So, and we know that adenomyosis is a challenging condition to manage surgically. Most times the ideal surgery is hysterectomy. But with HIFU, this condition can be managed and with achieving good symptom relief. So there should be increased awareness for adenomyosis, and the clinicians should have a high index of suspicion. And also people should be trained on how to diagnose this condition radiologically with ultrasound and other imaging techniques. HIFU is safe and has a low complication profile. And there are other benefits of HIFU, such as no anesthesia, no need for blood transfusion. It preserves the uterus and patient recover quickly after the procedure. Thank you.
Yes, thank you so much, Dr. Njoku. Yeah, I think there is a question here. Thank you for the presentation, Dr. Njoku. My questions are, what is the chance of recurrence of those myoma and tissue ablated? Is asking about recurrence of the tissue ablated. Is HIFU indicated in women with metastatic endometrial carcinoma? I thought you had said that cancer is something that we run away from. So maybe you have the response to that first.
Okay, thank you, Dr. Irebu, for the question. The fibroid is a monoclonal tumor. What it means that each fibroid tissue originates from a different cell line. So if a patient has multiple fibroids, each of them is formed from a different cell line. And when you treat a fibroid, the cell line that produces that fibroid doesn't grow another fibroid. And but another cell line that may grow another fibroid, but it has been shown from literature that the time from treatment of fibroid to the growth of a fibroid usually take about 3 or more years. And sometimes we advise our patient some of the things that may some of them that may prevent a regrowth. Things like pregnancy, the risk of regrowth. When you treat a fibroid and you advise the patient to get pregnant, it has been found out that if pregnancy happens after fibroid treatment, the risk of regrowth is lower. For the metastatic endometrial carcinoma, one of the things I mentioned in the contraindication is that it's not used for malignant gynecological pathologies. So it's not used for metastatic endometrial carcinoma. Thank you.
Yeah, what is the indication for Zoladex in all the patients that have had HIFU treatment?
Okay, for endometriosis, endometriosis is when the endometrial tissue are seen within the myometrium. And in endometriosis, after treatment, is usually give that first it helps with the symptom relief, and also it takes care of any residual adenomyotic tissue. Also, that's why we we give that for 3 months after HIFU treatment of endometriosis.
Of adenomyomas,
Of adenomyosis, rather.
So the only time we give the Zoladex is for adenomyosis, not for
adenomyosis.
Yes, not for fibroid. So the question is not right that it's all patients. No, it's not all patients. It's only for adenomyosis. I also observed that all the selected patients had an MRI done, considering the low resource environment we are in. Is the workup an HIFU cost effective? Maybe go on.
Yeah, go on. For evaluating this patient, MRI is very important to us. One of the things we use MRI to look at for is one, the location sizes of this uterine fibroid. Then another thing is the blood supply and the nature of uterine fibroid. We talk about hypo-intense and hyper-intense. When a myoma is hypo-intense, it's easier to treat with HIFU. So we can actually know the amount of power and the time where it may take to achieve adequate ablation. Also, it gives us insight on the blood supply. I talk about the malignant transformation of uterine fibroid. So where with MRI, you can actually see people with uterine sarcomas, you can actually see increased blood supply. Another thing it helps us is in follow-up. You can see some of the patients we manage. I show you the MRI before and after HIFU. So in follow-up, the T1 weighted image actually shows the enhancement of the myoma. It shows the blood supply of the myoma. After treatment, the myoma that we are ablated should not have any enhancement. You can see the dark area showing no enhancement. So because when these clients are treated for uterine fibroid, the fibroid takes time to shrink, but the good thing is that the symptom relief is quicker. The fibroid shrinkage, in about 3 to 4 months, we can achieve about 45 to 50% shrinkage, and up to 75% about 6 months. But the symptom relief is quicker. So for this client, for one of the images that can actually show this ablation is MRI, and we compare before and after. So these are some of the reasons why MRI is important.
So we shouldn't shy away from it that MRI is very important with if you're doing HIFU. And there is no, we talk about this low resource. We need to also move with the world. One of the reasons I'm sure why our pick-up rate for adenomyosis is very low is because we don't do MRI. Most people now who are treating fibroids who want to be able to differentiate between the two, also they're using more of MRI for the diagnosis, or they're going to do 3D ultrasound so that you can look at the junction and see whether it's thickened or not. So I don't think there is a shortcut to this. Thanks for the presentation. Do we have studies on pregnancy outcome after HIFU? Well, yes, not in Nigeria yet, but there is in Spain, it is center in Spain, Mother Teresa Hospital in Spain probably has the highest collection, apart from China, on babies born from HIFU, born after HIFU, sorry. But majority of these babies really and truly are born spontaneously. So we're going to work together with some other people, even on IVF after HIFU. Yes, but there's some records already, but the majority of them are spontaneous pregnancies after HIFU. This is from Benjamin Oranje. What is the cost of treatment for HIFU for a session? And are there repeated sessions to achieve 100% cure rate? Yeah, do you want to take that? Or I don't know any method that gives you a 100% cure rate to start with. I think what we're talking about here with HIFU is about 90%. And just like you said, majority of the patients don't need more than one session. For the cost is 1.5 million. What are the types of cancers that HIFU can be used for in gynecology?
For HIFU is not used for gynecological cancers, but some other general surgical cancers like the hepatic cancer, that's the liver cancer, pancreatic cancer, HIFU can be used, but for gynecological cancer, gynecological is mainly benign tumors like uterine fibroid and adenomyosis.
Yeah, and some bone cancers as well. Solid tumors, yeah.
Tumors.
Thanks for the beautiful presentation. You laid emphasis on the type of abdominal scar. Does this affect the outcome of treatment in HIFU?
Yeah, the principle of HIFU, I may mention that the transducer that produces the ultrasound energy is outside the anterior abdominal wall, is extracorporeal, and the waves travel through the anterior abdominal wall to the target organ, that's the uterine fibroid and adenomyosis. So if we have a midline scar, yeah, generally the risk of complication, including skin burn, is very low in HIFU, about 0.2%, 0.1 to 0.2%. But I said that one of the key things we do is patient selection. So yeah, midline scar can be treated, but we also think about the scar thickness. And also we also do an imaging study to look at whether there is any adherent bowel between the anterior abdominal wall and the uterus, because there is what we call the acoustic part, the part the ultrasound energy travel before it focuses on the focal point. The bowel should not be within the acoustic part. So these are some of the things we look out for when we have a client with a midline scar. And midline scar can be treated, but they have a higher risk of skin burn. But the complication rate is quite low, about 0.1 to 0.2%.
Okay. There's a question from Facebook. How many months after HIFU can one get pregnant?
The recommendation is 3 months after HIFU treatment. The patient should be reevaluated, and conception and pregnancy can be planned. One of the things we also advise the clients to do is a diagnostic hysteroscopy before that, either conception, treatment, or natural pregnancy.
Thank you. Do the patients have watery vaginal discharge after HIFU?
After HIFU, depending on the site of fibroid, there may be this transient watery vaginal, mild watery vaginal discharge, maybe for 1 or 2 days after HIFU, especially for submucous myomas. It may happen.
I want you to listen very well to this question. Is there a fibroid size limit that can be treated with HIFU? I would prefer answer in terms of fundal hive size.
Okay. Fundal hive size mainly is when we evaluate clinically the size of the uterus. It doesn't correlate with the size of individual myoma. Sometimes the fundal height may be quite big, but individual myomas are quite small. Maybe the person have multiple uterine myomas. For the size of the myoma we can treat, there is no limit for now for size. What size does to us is that it may increase the treatment time, the time required to achieve adequate ablation of the myoma. It may also, there is still option for what we call interval treatment. We can treat some parts and do another treatment to treat the remaining portion of the myoma. So for size, really is not a limitation for us in terms of HIFU treatment.
Yeah. Okay. I'm going to take one more question, and then we'll come back to the questions later on, and then so that we can let Mrs. Ashaye talk to us. I'm just going to take one more now. I saw one very interesting question here now. Yeah. Please, is HIFU recommended for submucous myoma? Is there a limit to the number of intrauterine myomas that can be treated by HIFU. This is from Dr. Kaka. Yeah.
Yeah, during the presentation, I showed the FIGO classification of myomas, and I made mention of type 7 and type 0. For submucous myoma, the only thing we are careful of is the pedunculated myomas that have a small stalk. And why we also exercise caution about these myomas is that after HIFU treatment, during the shrinkage, they may, because the tissue have undergone coagulative necrosis. So during the shrinkage, they may detach from the womb and float around the peritoneal cavity. We may require the surgery, laparoscopic or open surgery to laparotomy to remove. And yeah, but other types of subserous myoma can be treated with HIFU.
Thank you. We'll come back to the questions later on. I think at this point, I would like to invite Mrs. Ashaye to please take the podium and give us our presentation. Thank you so much, Dr. Njoku.
Thank you, sir.
Thank you very much, Dr. Ajayi, for inviting me to share my thoughts on financial literacy for doctors. Good afternoon, everyone. Thank you for having me. I'm sure we've heard quite a lot about medical terminologies. Now we're going to talk about finance, talk about money. The access to money, what can we do with money? Kindly give me access to share my slide, please. Thank you. Yes, financial literacy for doctors. We'll be looking at the following: the agenda for today, introduction to financial literacy, type of businesses, objective of businesses, the nature of accounting. What do we mean by accounts or accounting? Key accounting concepts, use of financial information, managing your hospital business as a doctor for people that own businesses, that owns hospitals, and we also talk about insurance requirement for doctors. And I will conclude. When we say financial literacy, what do we mean? It means the possession of knowledge and skills that will assist us in effective money management. How can our money continue to make money for us, basically? It also means the ability to understand how money works. And of course, financial literacy is the end result of financial education. All the financial education we have, that is financial literacy. The application, talking of budgeting, do you budget every year, beginning of the year? Do you monitor your budget? How do you monitor your expenditure? The cash left in your bank account, do you invest there? What type of investment do you do? Cash, bond, different ways. We're going to talk about all this. I love this quote. Knowledge is power. The more you know, the better off you are going to be able to create a better financial life for yourself and your organization. Also, financial literacy is the understanding of various accounting concepts and how they can interplay with life. Still, money, money, money. How can your money, multiply and make more money for you? Components of financial literacy. As I said earlier, it involves how you allocate your hard-earned resources or income among competing ones. And I'd like to raise some questions. Do you know your hospital monthly, half-yearly, or yearly projected income? Do you have a yearly budget for your hospital? Do you know where your money goes every month in terms of expenses? Do you know the largest expenditure in your business, and do you follow it through? Do you monitor? Do you put control in place? Do you have internal auditors in your hospital? Do you have a portfolio of investment to grow your income? Do you know how to borrow efficiently and optimally when you run short of funds? Do you have insurance and mortgages to secure your future well-being? Financial literacy is the basic knowledge that people need to survive in a modern society. All this information relates to financial literacy, how to manage your money efficiently. It's important to give consideration to these issues to guarantee your future well-being and security. Type of businesses, we all know this: sole trader, partnership, limited liability companies, and companies limited by guarantee. We have the sole proprietorship, we have the partnership. They are different. One owned by one person, the other one by two or more people. We also have limited liability companies. This is a type of entity owned by many investors who are called shareholders. The company is either quoted on the stock exchange or privately owned. The shares of a quoted or listed entity are sold on the floor of stock exchange. This implies that as a shareholder, you can sell your shares whenever you like. The entity is managed with a view of making profits. Hospital is managed with the view of making profit. It is not a charity organization. That is why financial literacy is key. Thus, a shareholder gets two benefits: share of the profits in the form of dividend and appreciation in the value of shares. Of course, we must pay tax. Government is also a stakeholder in our business. Companies limited by guarantee, NGOs, I know doctors, hospitals are not NGOs. Objective of businesses, basically to deliver value by rendering services and executing corporate social responsibility initiatives. Basically, those are the two objectives of any organization. Of course, all this involves money. When money is earned or expended, financial information is created, and accounting record is required. Financial literacy involves possession of knowledge and skills to make informed decisions about our financial resources and all money matters. Nature of accounting. Accounting is the provision of financial information needed to take economic decisions, especially in respect of acquisition and efficient use of scarce corporate resources. It involves gathering information, recording, and so on and so forth. What are the outputs of accounting? The stakeholders of corporate entities require financial information to enable them make economic decisions, either to invest in your company or to continue to stay in your company or to divest, leave the company, and or to diversify their investment portfolio, depending on what your accounting record says. The stakeholders or shareholders of a company will take either of these decisions. Accounting information affords numerous stakeholders the opportunity to assess the stewardship of managers of corporate resources, as well as the worth and viability of the enterprise. When you see the financials of any organization, you'll be able to know whether the company is viable or the company will soon, close shop. So we have different concepts in accounting. We have the entity, which says that the business is different from its owner. It has a life of its own and must be treated differently. The capital, this means the funds raised, by the entity to carry out its activities, and they can come from different sources, either in forms of cash, land, etc. Also, still talking about accounting concept, we have assets which can be fixed or current. Fixed assets are land, okay? And also current assets, they are cash in the bank and receivables. We also have liabilities. These are obligations which the entity owes to third party. For instance, money owed to suppliers, loan taken from banks, they are liabilities to the company. Cost of goods sold or services, these are the amount incurred to produce goods and services before they are sold. Okay, they also include some amounts incurred for advertisement, transportation before you eventually take to the consumer. Okay, all these are familiar. Selling price, the revenue, turnover. Revenue, turnover means the total amount generated for a particular period of time. Profit, we all know what is profit. Okay, the difference between selling and the cost price, or the investment and the returns. Receivables, we all know that is the money expected from customer or for services rendered. Okay, for instance, credit sales, which has to be managed. Okay, payables refers to money the entity expects to pay to customers or third parties arising from the services rendered or goods sold on credit to the entities. All these are important because they form the foundation upon which a statement of account, either audited account, management account, are prepared. Okay, depreciation. Okay, this refers to wear and tear of fixed assets. All the equipment Dr. Ajayi showed us, he needs, to be making provision in his account, in his books every year. Okay, so that in the future, maybe the lifespan is 5-10 years. By that time, he will have accrued money in the account, to be able to replace that equipment. Okay, that is what is being referred to depreciation. A certain amount kept aside for future replacement of fixed assets. And of course, cash is king. The viability of any business has to do with, amount of cash. Okay, when an entity or hospital has enough cash, it can easily take advantage of emerging opportunities. Entities that sells goods and render services on credit, of course, if you allow people to come to hospital and they don't pay, it's just a question of time. The company can become insolvent. So we need to monitor the credit we give, to our clients. Also, the time value of money. The value of money changes with the passage of time. If you put your money in a savings account, of course, the bank will pay you different than keeping the money in the current account. How can we raise capital if you want to start your own hospital, for instance? We can raise from personal savings, loans from families and friends, cooperative society, partnership, sale of shares to people if you don't want to pay interest. Okay, banks and other financial institutions, but this has a lot of implication, okay, in terms of payment of interest, okay, also interest of savings, and also buying on credit. Shareholders and owners of the business. Who are the people that really need this financial information we're talking about? Okay, of course, shareholders and the owner of the business, they need to know that the company is still healthy, okay, and it's still a going concern. They want to assess whether it is managed in line with the set goals and vision of the company, and also to determine if the business can pay back funds invested over time by creating wealth. Also, managers of the company wants to know how viable the company is, okay, to determine, whether the company will still be in existence for another 5-6 years, to determine if the goals of owners have been achieved, to assess their performance and how they are creating wealth for owners. Investors, of course, they want to assess the returns on their investment, and also to decide whether they should stay in that business or to divest or diversify their investment. and also to determine compliance to corporate governance best practices, and to determine how well you are doing in respect of taking care of your environment in form of CRS, corporate social responsibility. Lenders also want to have information about the finances of the company. Why? Okay, they want to determine whether to give the entity more loan or whether they have the capacity to pay back the loan already given to you. They also want to know if they are making enough profit, if the company or the hospital is making enough profit to meet their maturing obligations, and to compare what the entity owns and owes, assets and liabilities, and also to determine how money flows in and out of the company. Still on the users, of course, the suppliers of goods and services want to know as well whether it's a viable hospital to work with or not. Also, government too want to know. They're also interested. They're stakeholders in our businesses so that they can determine the tax liability of the hospital and also for statistical reasons. Also, customers want to know too, okay, to determine the ability of the entity to survive and meet their needs, and to determine its ability to pay what it owes. Employees, they want to ascertain, okay, whether the hospital is an employer of choice and also whether they can survive in the long term. The general public, of course, they're also interested to determine how well the entity is taking care of the environment and its contribution to the national development. Now, we then go to how you need to manage your hospital. How best can you manage your hospital? When you talk of finance, we've talked about the technical aspect, okay? Knowledge is important, experience is important. Also for finance, because when you make this money, what do you do with the money? Managing your hospital business as a doctor. As we all know, hospital is a place where we care for people. However, the sustainability, the long-term sustainability of the hospital depends on how it is managed. And one critical management tool is accounting information. As a doctor, you need to understand the cost of setting up and operating your hospital. Most of the equipment are fixed assets with longevity of life. And as you use them, as I said earlier, they will suffer depreciation. And so you must provide and save towards their replacement. This is very important. There are also consumables that you use every day that must be procured in large quantities to enjoy discount. These consumables are your variable costs that must be covered by revenue generated, by the business. And if your revenue cannot cover your costs, it means the end is very near, which means please exit the business to cut your losses. Also, to be able to do this, you must manage the hospital like a business, and it's actually a business. It's not NGO, it's not a charitable organization. You must know the quantity and the actual cost of drugs and consumables procured. Maintain an inventory register for all. Ensure that all financial records of purchases and receipts are kept. Charge patients reasonably for services rendered so that you can cover your variable costs and have something left to contribute towards taking care of fixed costs and other overheads, i.e. payment of salaries, rent, maintenance, and so on and so forth. So what are the critical issues in management of your hospitals? Number one, ensure that all cash collections or payment are received, because receipts are necessary for preparing the accounting record. Ensure that all receipts have serial numbers for ease of control and accountability. And of course, do not render services on credits. If you must give to big companies, it must be well monitored, so that they are not owing you for months. It's like giving them loan, giving them credit. Ensure that patients, including friends and relations, pay for services rendered. We also need to follow money to the bank. In other words, all payments made by patients must be appropriately accounted for. We also must ensure that all revenues are banked. All these are very important. On no account should any expenditure be made from daily collections, because it will distort the accounting records. Even if you are the owner of the hospital, do not take money from daily collections. Draw a salary like an employee, not just, to call the accountant. Can I have 50,000 there? Can I have 100,000 there? It will not help the business. All expenditure must be authorized. If need be, you can maintain an impress account, and we must strive on a daily basis to reduce operational costs. Since talking about managing your hospital as a business, as I said earlier, you must provide for depreciation of fixed assets, prepare annual budgets that will drive your activities. You must have a budget for running your company or your hospital. Beginning of the year, you must come up with a budget. This is the income we should be able to, have this year. Divide it into quarterly basis and review them. This is the expenditure for the year. We should be able to make a profit of this amount by the end of the year. Try and also have a strategic session to discuss your budget, discuss income. How can we achieve this income this year? By the time you have a strategic section with your team, you'll be able to see clearly the vision and the direction on how you can make that happen. You also need to monitor the implementation of an approved budget, especially the two sides, both the income and the expenditure. Especially the expenditure. Because if you cannot generate the income, if you are planned, but if you're able to drive down the costs, you can still achieve the level of profitability that you have planned for. Also, you need to insure assets and also yourself. This is where insurance comes in, which we are still going to talk about. If you insure your assets, it means if anything happens to it, the insurance company will pay. It's like protecting your future against any unforeseen contingencies. We're going to talk about that later. Yes, I think it's actually the next slide. Your hospital, you can insure against fire insurance, which covers your property against damage caused by fire insurance. It must be accidental and there must be actual ignition. Arson is not covered, which means setting your hospital on fire. This will not be covered by any insurance company. And insurance premium is so cheap, very cheap. For instance, if your building was 70 million, you can pay premium as low as 87,500. For goodness sake, it will save you a lot of problem, when it happens, when there's any fire incident. Less than 100,000, you have protected your building, worth 70 million, and if anything happens, you can go to sleep. Also, still talking about burglary insurance, you can also insure the content in your hospitals, even in your home, against, theft accompanied by forcible entry to the premises and loss or damage to your premises. The insurance company will pay. You can also imagine if the value of the content, the valuables, in your hospital or your home was about 50 million naira, you can pay premium as low as 85,000, very low premium. Okay, this is an amount that some of us take out for dinner or for lunch. Okay, and you can imagine if anything untoward happens, if you don't have insurance, one is left naked. Still talking about insurance requirements. We have group life insurance. This is actually compulsory by law. It covers death of employees while in the service of the employer, either as a result of accident, natural causes, COVID, anything, any form of death is covered. Okay? And it's compulsory by law that you must have a group life insurance policy for your employee. Even doctors, your association as well, can also have group life insurance on a personal basis. And it's so cheap. For instance, if you want a benefit for 2.5 million naira, you just pay 15,000 naira. Group life insurance is the cheapest form of insurance I've ever seen. 2.5 million, you can pay as low as 15,000 naira. Okay? And especially now with COVID-19 ravaging the whole world, this type of policy is very important, you know, for hospitals to buy for their staff, and also doctors as well, you know, to take up in event of any eventualities. So still talking about insurance requirements, you have motor insurance, which is very common, okay, covers so many things: accident to the vehicle, fire, damage, theft, liabilities to third parties, okay, damage to third parties' properties, and you can also imagine the level of benefits, okay? If, for instance, you run into any vehicle, third party, the insurance company must pay liability up to 2.5 million. Towing limit for any breakdown of vehicle up to 60,000. Medical expenses, 200,000. Strike and any damage as a result of strikes, riots, and commotion is also covered. And for goodness sake, the premium is also very small because insurance operates on the law of large numbers. Okay, pool resources together. You can have close to about 1,000 or 2,000 clients pooling the money, the funds together. Okay, like this typical ajo that we do. Okay, pulling funds together, and it's only very few of them that will, you know, be involved in an accident or that we have to claim under the insurance company. And that is how it operates, because I'm sure a lot of people are wondering, are you sure this low premium, are you sure they will be able to pay claims? Okay, gone are those days. It's different now. Insurance companies, they do pay claims because they are under strict regulations. Just like CBN, we have National Insurance Commission, okay, that are really, really working so hard, you know, to bring sanity to the industry. Okay, for instance, for money insurance, you can have a rate between 2.5% and 3% of the value of the vehicle. Okay, a vehicle worth 5 million naira, the premium will be as low as 125,000 naira. And if anything happens, if it's stolen, accident, okay, or fire, the insurance company will pay the 5 million less policy excess. Professional indemnity insurance, which is very good for all professionals, including doctors. It provides protection to doctors or any professionals in any field whose services inherently requires that they observe a duty of care to their customers. When the duty is breached and the affected customer resort to legal actions to remedy the negligence, the insurer will shoulder the financial responsibility that may arise if that professional is found guilty. Okay, what am I saying? The policy will pay for any claims made against them for breach of duty of care during the occurrence of the policy. For instance, if you want to buy a professional indemnity policy for 5 million, the premium is as low as 50,000 per annum. The association can come together under a group and take this policy, okay, and they will be able to enjoy discounts from insurance companies. Concluding remarks, distinguished ladies and gentlemen, doctors, It's important to mention and emphasize that hospital is a business entity. It is different from the owners. Its survival and sustainability depends on how it is managed. Accounting of financial information enables you to determine the performance of the entity and comply with all industry regulations and law. Also remember that cash is king. Avoid credit sales and render free services to friends and relations. Set and follow your budget at the beginning of the year and follow through with the budget. Follow the money to the bank by ensuring that all payments are accounted for and banked. Never take money from daily collections. Pay yourself a salary. Hire an accountant on part-time or permanent basis. And ensure you assess yourself and your staff to ensure continuity of business. Distinguished ladies and gentlemen, thank you very much for your attention. God bless you. Thank you.
Yes, thank you so very much, Mrs. Ashaye. I'm sure many of the doctors will have learned one thing or the other, like I have. Actually, you know, I took this gamble to bring a non-medical thing to doctors. And I was watching to see whether they will disengage, but they have not disengaged. That shows us this is important to them. And so thank you so much for giving us your time. I know you just came back, and for you to be with us today took some trying. Thank you so very much. I don't know if they have questions, or I have learned a few things again, which I want to reemphasize. Follow your money to the bank. Nobody, you know, when I was a young doctor, my boss used to come in the evening and say, look, how much have you guys made? Oh, I need 50,000 naira. And they will go for the weekend, you know. That's what kills a business. The doctor is different from his business. The hospital is a business. Stop taking your expenses. You want to buy a freezer, it's from the hospital money that you are buying a freezer. Come on, what are you doing? You know, so I'm so happy that you said this. All revenues must be banked.
Yeah. So
thank you so very much. And I'm sure I've not seen any questions, but I'm sure they've learned, all of us have learned one thing or the other. There are some people putting up their hands. It might be difficult to allow you to talk. That's why we said, please drop your questions. I'm not sure whether we can do that. Can we attempt to see if one or two people can? Because I see there is Dr. Afolabi Gania. Let's see. I will attempt to let them talk. I don't know whether we can do. Oh, okay. I think Omoke, can I? Good. So I need to promote to panelists. Okay. Maybe if we just allow one or two people to yes, and Lazarus, he also wants to talk. Yeah, so Lazarus or Kafo, can you please ask your question if you want to? I don't think we can take more than two people talking. Okay. Can you please take your question? But you need to unmute if you want to talk. Okay, what I'll do is probably read some of the, okay, it's just Lazarus Okafor is just showing us his handsome face. Okay, I will try to see if I can read some of the comments. Somebody is asking for, thank you, Ma. Your presentation is enriching, okay? Thanks for the wonderful presentations. As doctors, we need to hear more of this. Thank you so much. Oh, okay, this is from Dr. Additional. I wish you appreciate Nordica for these interesting lectures. Thanks. All right. For a private practitioner, how can he have professional indemnity insurance? Okay, fine. This is from Ove Bernard. For a private practitioner, how can he have a professional indemnity insurance?
Yeah, you speak. I'll leave my number here so you can get in touch with me. I run an insurance brokerage firm. We are intermediaries between insurance company. Get good terms for you and make sure that when there is a claim, we represent your interest. So I'll leave my number on the chat box.
I think also, I think that's one thing I didn't know about you. I think maybe because we have professional indemnity insurance, so I think we better just use you as the person that will be in charge of that. Yes, thank you for the presentation. I'm going home with pay yourself salary. Yes, Dr. Oyemachi, please pay yourself salary. I am on salary. Everybody should be on salary. You can have directors' emolument, you can have anything. It must be fixed. Not that you just put your hand into the coffers of your company. You are robbing the company and you are not making it to grow. Okay, thank you, Mrs. Ashaye has left her contact. So, good afternoon all. It's a needful presentation. Thank you, ma. Great. Thoroughly enjoyed the presentation. Thank you, ma. Okay. So I think it paid off. So thank you so much. There is indemnity. Somebody is asking, there is indemnity. I don't like doctors just talking only about medicine. That's why I think we should broaden our horizon.
Yeah.
And, yeah. Okay, sorry, I saw something very interesting. Thank you for the fine presentation. Can you add more light on depreciation? Thank you.
More light on what? Depreciation. Yes. Generally, depreciation for most assets between 20%, 25%. If the lifespan of the asset is going to be 5 years, that means you need to depreciate that asset 20% every year. What am I saying? Assuming the asset is 5 million, what is 20% of 5 million? I think that should be 1 million, right? Okay, which means, okay, 1 million will be part of expenses for the year. Okay, the expenses part, we capture that. It's not going to go out of the company, it will be in the company. That is provision for depreciation. It's always, in the administrative expenses, provision for depreciation. If it's 5 years, 20%, okay, and after 5 years it's fully depreciated, you can still continue to use it, and also, if you like, you can still continue to depreciate. That means you are accruing fund, okay, for the future purchase. So that at the end of 5 years, you are not left dry because you have not accrued money for that asset. Like that gigantic, is it HIFU that the doctor bought? I'm sure it runs into millions. Doctor must start depreciating for it now. So that if it's 10 years now, in 10 years' time, definitely that equipment, we need a replacement. And doctor must have the money somewhere. Okay? If you don't depreciate such assets and your account is showing profit, okay, that means there are some assets that you have not actually charged for. It's like charging for those assets. Okay? So once you charge for it in your management expenses, after 5 years or 10 years, the money is in the account for you to replace that asset.
Thank you. Thank you, Ma. Now, this is a question I want you to, please, I want you to be the one to answer it. If you are unable to pay yourself from the income generated in the hospital due to lack of funds, would you say it's a failed business? And what is your advice on this?
Okay, thank you very much for that question. if you cannot pay yourself, what are your future plans? Can you? Is it not possible for you to also bring a consultant into the business to help you look at the business all over again? Come up with strategies that will drive that business. Okay? Can you not also bring in, bring your team together and look at successful businesses, not only in Nigeria, okay? Understudy them. You have all this information on YouTube, Google, everywhere. What have they done right? Even in Nigeria, there will be businesses that are doing well in your field. Okay? I think consultants, most times, they do a good job in respect of this. They will give you advice, they will monitor the implementation and ensure that you bounce back. If you are also committed, to this. Thank you.
Yes, yes. I want to
pay yourself, that means there's no salary.
I think one of the problems we have as doctors is that we start businesses. We don't have a feasibility study. There's no business plan. There is nothing.
No.
So how can you run a business that you can, unless you are a Red Cross? If you cannot pay yourself, so you need to go back and reevaluate the business. What is happening? Do you need to partner with other people?
Absolutely.
Because this idea that everybody wants to be MD is killing us.
Yeah.
You can come together. Look, I visited a hospital in the United States. There were 200 gynecologists as partners. 200.
The same thing in South Africa. I think they have one hospital village. Everybody will come together, share resources. Okay, like this equipment now, everybody will bring their patient in there, and they charge costs. So there's need for collaboration.
Collaboration, that is the word, man. Thank you so much, because that is one thing that we doctors, we do not do. We still think we're in medical school where we're competing against one another. Yeah. We're in the world. There's collaboration, not competition. When you have a service, I find it very funny. You go in a town, for example, you have 10 MRI machines. In that town, they don't even need more than one MRI machine. So why do you have 10? So we need to start looking at these things from the point of view of what is my capacity utilization? Why should I start this now? Why not another thing that will be of service to this one? So I think that's where we just need to start looking at this is a business. This is a business that we're running. It's not a charitable thing. And one of the problems that we have sometimes is that we because we are either working in a government hospital, we're still working with the government, and so we see this as a side attraction. And then, look, what I say is that sometimes is that we are putting the elephant on your head and you're chasing after crickets. Okay? Because we need to look at this thing as business and run it as such. And sometimes you might, even if you don't have the capability, employ somebody that can help you in running it. So, thank you so very much. I mean, I see many doctors who have run businesses for 5 years and they cannot even look at profit and loss. I can't. So I now ask, what have you been doing for the sake of Christ? So I think one take home today is not that we want to castigate anybody, to see that there is a need for us to also let the professionals do their job. And then we also need some training in order for us even to be useful to our businesses. So thank you so very much, Mrs. Ashaye. And I'm sure if there are other questions.
Just to add.
Yes, sir. Yes, ma'am.
Lagos Business School, they normally have a course on accounting for non-accountants. And I'm sure there will also be other smaller organizations, consulting firms that can also put that together. You know, accounting for non-accountants. It will help a lot. Thank you.
Thank you so very much. Dr. Njoku, I think all the questions will definitely send them, and then we'll address them. I think at this point, I think we need to rest now.
Thank you very much for having me.
It's just wonderful. I'm sure we're going to do this again. So I've learned one or two things also, and I guess majority of the doctors have also taken something home. So thank you very much for coming, Mrs. Ajayi. Thank you, Dr. Njoku, and then we'll definitely see you again. Thank you, everybody, for being part of this. Dr. Lutu, wonderful having you. Dr. Badebo, thank you very much for being part of this, and I'll see you some other time. Thank you.
Bye-bye.